This probably doesn't come as a surprise to anyone, but the #1 health and wellness resolution for the new year, weight loss.
That's right, perennially. I think that it always is. Well, the good news here is that up to 90% of the people who undergo gastric bypass surgery will keep off at least half of the excess weight that they lose.
Dr. John Schram is a weight loss specialist with Spectrum Health Medical Group, and he's here to share some options for success. We know that people are thinking about this because of the resolutions that have been made. So how does this play into the picture for some people that want to change their lives?
Well, I think, the important thing for people is not just about weight loss, and I mean, that's a big resolution for many people, but for a lot of people too, it's more than just weight loss. It's about, I want to get rid of my diabetes this year, or I want to get rid of my hypertension this year, or I want to be able to sleep without a CPAP machine, or I want to lose this cholesterol, and my parents have had heart issues, and I don't want to fall into that risk pool. And so I think that what we like to think about is it's not just about losing weight, it's about gaining health. And the operations that we do, whether it's a bypass or a sleeve, are really more metabolic operations, and they do so much more for people than just weight loss. In that, 70 to 80% of the people who we operate on, their diabetes goes away within the first several months of the operation. So we really make some huge changes in people's lives.
It is really incredible when you think about the way, the advancements too in the surgery, the technology is just incredible. Describe what we're seeing here. Yeah,
we do about 99% of our operations through the laparoscope now, which means instead of big incisions, almost all of these operations are done through small poke holes and done as sometime overnight stay in the hospital.
One night?
One night stay in the hospital. Wow. For almost 90% of our operations.
And how is that better for patients, not to have
Well, to be able to get up and walk around and not have painful incisions, and to be able to recover not only from their incisions faster, but they're eating fast, drinking faster, eating faster, getting back to normal life. So even with these major operations, most of our patients are back to work, usually within a week or two of the operation.
That is pretty incredible. Okay, so 90% of your patients keep off more than half of that weight. That seems like a really incredible, because we know that that is something that happens a lot. People lose large amounts of weight, and then many times, not all times, they will gain a lot of it back.
I think, you have examples where people, and I tell all of our patients that we are going to create in them a tool that will allow them to diet more effectively. And then it really is about how well they use the tool. Fortunately, the vast majority of people, if they get the right support, they get a good multidisciplinary team behind them, will have tremendous success. And at least 90% of the patients who we operate on will keep at least half of their excess weight off. Most of them do much better than that. But it requires a team, it requires, a good foundation of support behind them to be able to help them to use that tool lifelong to do well.
And you think about, I want to look better, but boy, some of these other byproducts are just remarkable in the way you improve your health.
Yeah, it's amazing. I mean, just to be able to get off their diabetic medications is huge for most people.
So what happens? How does it start? Because if someone has resolved to live differently in 2014, they start by going to see you, and it's probably something that they will follow for much of this year with your team of people.
Yeah, so the process can take, anywhere from a month to 6 months from the time they see us. But it's just as easy as calling up and coming in for a consult. And we do a group seminar where I'll talk to a group of people, and I'll meet with them individually. We'll go through their risk factors, we'll go through their health issues, we'll try and figure out which operation would work best for them. And then once we've done that, then we'll work with them and their insurance company. We've got folks on the team who will work with the insurance companies to kind of help them guide through that morass, which can be a tough issue for some people. We try to make that as easy as possible. And then we'll start, a program, and we'll get them in to see the dietitian, we'll get them in to see the behaviorist, and we'll work through a very structured but kind of a straightforward program that allows them to be successful. And then after the operation, support them as best we can to make sure they're using the tool as good as possible, so they have tremendous success.
Yeah, a lifelong journey, but
it's a lifelong journey.
You talk about just those vast health improvements. It's got to extend people's life expectancy.
Every study that's been done that's looked at weight loss surgery has shown an increase in life expectancy after the operation.
That's wonderful. So we have your contact information if people are interested in talking with you about this option and what might work best for them. They should contact you. Can do that by calling these numbers here, by going online. Dr. Schram, thank you so much, because we know that it's a busy time for you right now.
This is a busy time.
And it's exciting, too.
It's an exciting time. We're helping a lot of people, and it's really fun to be able to help people right now.
Yeah, it's got to be gratifying for you.
The most rewarding job there is, without question.
Thank you.
Thanks very much.
We'll be right back.
This is 8 West.